Right. I think it's 10 past 11. Let's make a start. So, welcome everyone to Hive Medical Academy and our today's webinar. Thank you so much for spending some of your time on Saturday morning and joining this webinar. We have got Dr. Wahid, we have got Dr. Murtaza, we have got Dr. Kashif, so and lots of other people. So, thank you for joining. So, in this webinar, there are three parts of the webinar. We First part, we will going to give you some introduction about the challenges and difficulties, hardships for the international medical graduate they could potentially face during their PLAB journey. In the second half, we will be focusing on the communication skills for the PLAB 1 and PLAB 2. And in third half, we will be just giving you some answers to all your questions and anything in the future you like us to teach you or give you something. And most important, we will also announce about the NHS program, which Dr. Omar will be giving you more details about it. All right, so this is just a brief about me. I'm Dr. Shakil Malik, being an international medical graduate. After completing my training from junior doctor to consultant in the NHS, being in NHS for 20 years, and then moved into full-time education. Then we have got Dr. Umar. He's our co-founder and academic lead of Hive Medical Academy. He also brings a wealth of experience of 20 years. He's been a tutor in Manchester University, PLAB tutor. He's been mentor for nurses, pharmacists, junior doctors, foundation doctors. So there's a you can understand that you can see there's a wealth of experience behind the High Medical Academy who are here to help and support you. All right, so let's move on about the key challenges. Taking PLAB journey or moving from one country to different country from one health system to another health system is a big decision, and it takes lots of strength, confidence, and courage to make a decision because there are so many things. Some are the myths and some are the true realities which we need to know. The first most important thing which comes in the mind when you're planning for any trip or any journey is the financial pressure. If I'm going to plan this journey, how much it will cost me and how I'm going to manage it. What sort of the training is there and what's the exam fee, what's the preparation fee, what's the traveling cost, how I'm going to get the visa, what's the visa application process, immigration, would I get visa or not? And I'm a working doctor as well. I'm supporting my family. So how I could balance my responsibilities and my work-life balance, and how I could manage time to study my exams as well and prepare for my exams. But then most important thing is cultural adaptation. If I'm moving to a different culture, a different country, obviously UK is a diverse and multicultural society. So am I going to adjust there well? What will happen if I could not? What sort of the things I need to learn about the UK culture? And how it will help me, Hive Medical Academy or anybody else, how they could help me. Then again, these are the sort of the logistics things like where you think about the financial crisis, financial support, and expected or potential expenses. At the same time, you must know about when should I apply for the PLAB? What stage? Am I final year student? Am I ready to apply for my PLAB exam? Or should I apply when I have graduated? Or do I need to do my internship? Is internship compulsory? What are the requirements for the PLAB exam? Am I eligible or not? And what sort of resources I need for the preparation? Do I need an academy? Because today's digital world, we have got multi-million resources available on internet. Are they credible? Are they reliable? Who are those people who are providing these resources? So who should I trust and how should I go with my preparation? Do I need an academy? Do I need to get just some tutors, or do I need to get online resources, or do I need to read books? Then again, if I where the PLAB 1 centers, can I take PLAB 1 in my country, or do I need to travel to UK? Or what about the PLAB 2 visa? What sort of the visa I will get, and how I will get the visa? Who will help me in getting the visa? Uh, so these are the things you need to understand. Uh, eh, So how will I commute to and from the academy once I have reached to the UK? How I'm going to commute from one place to other place, and who is going to help me to get my NHS job? How do I ensure that I'm ready? Who is going to prepare me for my interview? Would I get any mock interview? And how I'm going to get some clinical attachment? Who is going to help me for the clinical attachment? I have heard, people say that we heard that there is a long waiting list for the clinical attachment and all these things. So these are the worries, these are potential concerns, and sometimes these are the hurdles which people, when they're planning to decide to travel to UK, because of these difficulties, they don't speak up and they just cancel their plan. Right. Again, if PLAB exam is not just an ordinary exam, if your exam of another country's regulatory body, and you need to understand that there will be exam structure, and if I fail it, because it's expensive exam, obviously you have to pay a fee to GMC to attempt the exam. If there's a fee, and if I fail the exam, what will happen? Do I need to pay again to academy for the preparation resources? Or do I need to pay to another tutor? How will it go? If I fail it, what will happen? Where I will end up? Again, exam, as I said, this is a different exam. Exam structure is completely different, and resources are different, and the way they take the exam is completely different as compared to your country exam or as compared to the exam you have taken in final year, first year, final year of professional exams, MBBS or MD. Culture system and transition, how I'm going to transit from my culture, my working environment, my country health system to a completely different UK healthcare system. So there is a big learning, and we need to understand that if I'm making this transition, what are the important things which I need to learn, and who is going to help me, who is going to hide me, who is going to support me, who is going to hold my hand while I'm making this transition from one country to other country, one culture to another culture. Right, and we have got then some talking about the myths. Uh, yeah. There are some myths as well about the PLAB 1 exam. People think that the PLAB is a very easy exam and anybody could go and pass. If you have got MBBS degree, you'll go and pass exam. No, it is not easy. If you have not prepared well, exam is very hard. This structure is because GMC is assessing you. Your clinic in part one, they are assessing your clinical knowledge, and in part two, they are assessing your communication skills, your practical skills. They want to make sure you are a good doctor and you are a safe doctor. So it's not an easy exam as far as you have got full support, full guidance, and somebody is guiding you. People like who have got exposure, who have got experience, and who have got dedication, and who know and who have been part of the system. Those are the right people who could guide you properly and betterly. Passing PLAB guarantee a job in the UK. Right? Passing PLAB is passing another any other exam or any other test. Passing certificate is just a piece of the paper. If you have got passed, it would not guarantee you a job. What you need for the job, you need to make sure you are properly skilled. You have got things which are important, like your communication skills are important. You are well prepared for the interview. You have done your clinical attachment. You have got your local reference with you. You have attempted mock interview. So if you are thinking that after just passing a lab or straight away I will get the job, no, it does not work that way. You need to prepare yourself. Your standard, your experience, your interview skills should be equal to the any other doctor who is appearing in the interview. So if you have got the clinical attachment, if you have got your local references, you have prepared your mock interview, and you stand out in the interview, you will get the job. UK culture of medical practices are not difficult. They're far easy. And people coming every year, almost 30 to 40,000 doctors coming, international medical graduate coming, and they are making this transition very smooth, very easy, as far as they are getting the support and help and proper guidance. So transition from any other culture, any other country to the UK, it's very easy, very smooth, and we make it very easy. We help them because we put you at the center of everything. At the Hive Medical Academy, we put you at the center of everything. We do all those things and we prepare you, we train you for all those things which you need to become a successful doctor in the UK. Another myth that you can take PLAB unlimited times. No, not at all. PLAB 1, maximum attempts you are allowed 4 times. If you could not pass your PLAB 1 after 4 times, failed 4 times, Then what you need to produce evidence, and you need to show evidence to GMC that you have improved your clinical knowledge. And you need to request a GMC on the special request and special cases, GMC would allow you the fifth attempt. But if you have failed four times and if you have failed fifth time, unfortunately GMC would not let you take PLAB exam again. Then will say that you need to look into something else. PLAB 1 valid for the 2 years. Within 2 years, you have to pass your PLAB 2. If you can't pass your PLAB 2 within 2 years of passing your PLAB 1, then obviously you need to start from the scratch. You need to take again. PLAB is only for the junior doctors? No, PLAB is not for the junior doctors. Any doctor at any stage of their career, at any age, they can take the PLAB 1 exam. Briefly, in the next few slides, I will explain what's the eligibility of the PLAB exam. But even the final year students, they can start preparing for the PLAB 1 exam. But all the doctors, junior doctors, senior doctors, are at any stage of their career, they're eligible to take the PLAB, and there is no age limitation for the PLAB exam. So there's people ask that, you can't prepare while I'm working, I'm doing my house job, and I'm working full time as MO. I can't do it. No, you can. Because at Hive Medical Academy, we will set a planner for you. Either it's a 60-day planner, 19-day planner, a 120 days planner. We'll give you the proper planner where that will include your work-life balance and your exam preparation. So we will discuss with you, we'll prepare your schedule, we will help you to prepare that. Um, Again, it's eligibility. I will in next few slides, I will explain in detail about what is required, who can take the PLAB exam, and what are the documents and what things you need. After PLAB, straightway you start working. As I said, passing PLAB is just passing any other certificate exam or passing any other test. It's your PLAB pass result is just a piece of paper unless you prepare for the post-PLAB things. You need to look for the clinical attachment. You should have your interview skills top up. You should have CPD courses. Your CV should be of NHS template, NHS standard. As far as you have got all these things, and these are done professionally, and if you have got any gap in your CV, which has been reviewed by the consultants and they have advised and they completed your CV professionally and properly, yes, you will get the job. But passing PLAB is not guaranteeing a job as far as unless you have got all those post PLAB things. You can pass PLAB 1 without any clinical knowledge. No, not at all. PLAB 1 basically they assess your clinical knowledge. They assess how good you are, your clinical knowledge. PLAB 1 is just about the clinical knowledge, and PLAB 2 is about your practical skills, your communication skills, your interaction with the patient, dealing with the difficult patients, breaking bad news, dealing with the power of attorney, dealing with the legal issues, dealing with the power of attorney issues. So PLAB 1, basically, they just assess your knowledge. PLAB 2, they assess your clinical skills and your communication, interaction with patient, and how safe you are and how good doctor you are. PLAB 2 centers are available worldwide. No, not at all. PLAB 2 only in the UK, in Manchester. Just few minutes drive from our office, where we are based in Manchester. Our office is just in heart of the Manchester, and PLAB GMC Center is in Manchester as well. So PLAB 1 you can take in anywhere in the world, in your country or any other country, but PLAB 2 is only in the UK. If I quickly summarize about what the potential difficulties were in the PLAB journey, what are the potential hardships or obstacles any international medical graduate could face, he has got some illusions or he is believing that these could be the hurdles. Understanding the PLAB exam, financial strain, visa immigration concerns, time management and study while working, adapting to the UK, transition from one country to another, transition from one culture to another culture, emotional and psychological stress. Obviously, you are moving to different, you're leaving your country. Some of the doctors who we met, they never traveled out of their country. It is a big step for them because they're attached to their family, all their family is back there in country. So there's a big emotional and psychological stress. And then managing the post-PLAB things, interview, clinical attachment, and communication skills, CPD courses, and there is additional support if they need it. Like they want to bring their family, they want to bring their spouse or other people. So what they need to do, or they want to buy a house, they want to get a car. So all these things, how they're going to work. Right. So we understand. While speaking to thousands of international medical graduates, we compiled that list of the potential hurdles, potential difficulties of the PLAB journey. So what we designed things that how we could deal with all these things. And being going through myself through this journey, I understand very well this PLAB journey. So what we do, how I help you, we do everything for you. And how we do it, you are our main focus. We put you at heart of everything. You are center of everything. We do everything for you. We prepare you for your English test. We'll prepare you for your PLAB 1. We'll prepare you for your PLAB 2. We'll help you to book your flights. We'll help you to visa application. We'll get you visa. We'll get you sponsorship letter. We'll pick you up from the airport. We'll arrange your accommodation. We'll arrange your clinical attachment. We'll prepare you for the interview. We'll help you to get the job. We'll help you to bring your family here. So everything our if you look into it, our aim is just you. All our attention will be at you till you get the job. And even afterwards, even after the job you need us, we will always be there. So we are going to hold your hand from your country from the day one till you're in the UK. You have made this transition successfully and you are working in the UK NHS successfully. So we have got the top resources. We have got the best team with the decades of experience, dedication, and hard work. We have got the best tools, and we have got the best guidance to give you, to provide you, to share with you our resources, our experiences, our skills, so that you could excel in your journey and you achieve best in the life. As I said, the comprehensive exam preparation, that's and your mental well-being as well. You will get the chance to speak to other doctors. You will have the social life. You will not feel like lonely, or you will not feel isolated. That way, we will support your mental health. You will support your physical health. Will help you to prepare your exams and to achieve best in the life. Will provide you the appropriate and required mentorship, and you will have the lots of other doctors from similar position for similar journey. You will have the networking with them, which will support and help you to achieve your goals. Again, it's the practical guidance and everything. As I said, you don't need to worry about that who is going to pick me up from the airport, where I'm going to stay, how I will fill my application form, how I will fill my GMC registration, and who is going to help me in all these things. We will do everything for you. If you want to have a look at some success stories, the lots of doctors who have uh, been through the Hive, some other junior doctors, some are working with the reach to consultant. So please visit our website and these our reviews, and those are doctors' stories who are in your position at times. They made the journey, and Hive held their hand from the day one till they moved to the UK. So please feel free to have a look at these links. Any question at this stage? Anybody wants to ask any question? Please just put in the chat box if you have got any questions. Uh, Right, so quickly I will carry on because we have got other two parts of the webinar as well, and Dr. Umar is waiting desperately. So PLAB journey for international medical graduate, what is required and how you can take it. So you must be medical graduate from any recognized medical college. You need to pass your English test, OET or IELTS. You pass your PLAB 1, pass your PLAB 2, PLAB 2 in the UK, and clinical attachment, get GMC registration, and start working. There is no other requirement by the GMC at this stage that you need. You don't need internship where you must have done internship. There is no other requirement. Medical graduate, English test, PLAB 1, PLAB 2, move to the UK, get the clinical attachment, get GMC registration, and start your job. Simple, straightforward. There's nothing else, no other requirement. Right. I will leave with this for Dr. Umar. These are the question distributions because today's webinar is mostly about the journey. Right. These are the links. You must, on the PLAB 1, if anybody is taking PLAB 1 sooner in February, please do read about the PLAB 1 exam, what you need. And the PLAB 2, if anybody is taking PLAB 2, they must read these guidelines. These are very important. And if you don't follow these guidelines, they might send you back from the exam. PLAB journey, as I said, English test, PLAB 1, PLAB 2, and attachment, and start your working. And this is how I will hold your hand from the day one till you get the job. Hi, this is our NHS program. Dr. Umar will be explaining more about it. This is one of the best program for the international medical graduates where they have very free life and their journey will be very pleasant and very smooth throughout the journey. Briefly, I will mention about the training system in the UK, or NHS training system, one of the best training system in the UK, I would say. Hi. So the fresh graduates in the UK, once either they're UK graduates or international medical graduates, they could apply for the foundation program. Foundation program is the 2 year training program, foundation year one and foundation year two. In year one, you will have 4 month rotation in three different specialties. In year two, you will have 4 months, three different rotations, different specialties. Aim of this foundation program to give you taste and exposure of different specialties. So you could know and you could understand, you could learn, and you know your taste as well, what you like. If you're doing medicine, you like more medicine, you like surgery, or you like orthopedic. During these foundation years, year one, you will have one clinical supervisor, and you will have one education supervisor. You will have your electronic portfolio. You will be completing your competencies, foundation competencies, your CBDs, your mini axes, your MSF, your audit projects, your presentations, your teaching. The working hours is 9 to 5. One day, half day you get for the teaching, and then you have got the paid annual leave. You have got study leave, and then you have got admin time as well. And all these 2 years job is completely paid. Starting pay is 36,000, and if you want to do extra locum from 30 to 50 pound per hour. Same for the foundation year two, you will have 2 years of program, 4 months rotation in three different specialties. Again, they will give you some taste, either you're doing what you like to do it. So, and you'll have two supervisors, educational supervisor and clinical supervisor. And then you move forward after the training. End of the training, you will have the assessment, and your supervisors, they will you guide you, they will give you your feedback, and they will train and support you for this journey. Once you finish your foundation program, then it's up to you because you will be in far better position after completing rotations in different specialties. You would know yourself that what you liked. What rotation did you enjoy? Did you enjoy your psychiatry rotation? Did you enjoy your general practice rotation? Did you enjoy your medicine, or did you enjoy your gynae rotation? Did you enjoy your ENT? So you will have the variety of experience, exposure, and you will be in far better position to decide, yeah, I like medicine, I want to go in medicine. Then it is the time. The specialty training program that's 5 to 7 year, that will every year nationwide vacancies are open, positions are open, and you will apply for that according to your liking or what you like or what you enjoy. If you want to apply for the medicine, ST1 to ST7, you will have the training, and during this training you have to pass your MRCP exam. Everything is fully paid. ST1, ST2, you will be SHO, then you will become the registrar, and after that you will start ST5 onwards, you will start working as a consultant. During the registrar, your pay will go up to 60, 70,000. Your hourly rate will go up to 70, 80 pound per hour. When you become consultant, your pay will go 100,000 plus, and your hourly rate will go 100 to 250 per hour. That could be more. Right. This is the hospital training. Same for if you want to go to surgery, MRCS, you have to complete during these trainings and you move on. Orthopedic, all other specialties you want to apply, you could do it. Then we have got the GPST training. In GPST training, you have got a 3 years training. General practice specialty training. You have got 2 years of the hospital rotation, either 4 months or 6 months rotation in different specialties. And 1 year of the rotation, 1 year of the surgery you will have in GP surgery, where you will have the educational supervisor, clinical supervisor, they will guide you. And during these 3 years of GP training, you must pass your MRC GP exam. MRC GP exam, it comes where like you have got the two parts, AKT, part one, about your knowledge assessment, and then you have got the CPSA, you have got CSA, you have to SCA or CSA, you have to pass CSA. So once you pass this one, you will do the CCT, Certificate of Completion of Training, and then you could work as independent general practitioner in the primary care. So GP training is of 3 years, pass two exams, MRC GP part one, part two, and you could work CCT, you could work as a general practitioner in the community or in the primary care. For the hospital consultant, is 5 to 7 years of training, complete and pass your relevant specialty exam. If you are in surgery, you need to pass your surgical exam. If you're in medicine, you have need to pass your MRCP, part one, part two. and CS PACES, part 1, part 2 PACES, and then CCT, and then you work as a consultant. So very simple, very straightforward. All this training is completely paid. Every second of the work you will do for the NHS, that will be completely paid. You will not be working unpaid or without wages, anything in the NHS. Uh, if I, yeah, so as I said, Hive, you are our focus. You are our main focus, and we put you at center of everything. You are at the heart of everything. So our ultimate goal is to help you to make this journey pleasant, smooth, and help you to pass your exams and get you working as a doctor. Quickly about the benefits working in the NHS. As I said, NHS is one of the world's best healthcare system. And same obviously working with NHS, you would not be without any benefits. So you have got plenty of benefits in NHS. You have got paid annual leave, 35 to 41 days. You have got the you can get easily mortgage by if you're buying a house, if you're buying anything, if you're getting a lease car, you'll get the loan. You have got the very flexible working hours. If you want to work part-time, you want to work full-time, you want to do a few hours a week, or you want to work only on weekends and you want to chill out rest of life. Yeah, you have got plenty of options. You work NHS discounts, you get discount on your insurance, you get discounts on other things, and even your daily grocery, you will get the NHS discounts. Apprenticeship schemes you have got for your children, if they want to go on any apprenticeship, they have got those sports in that one. So plenty of benefits in working while working NHS, and when you retire, you have NHS pension. NHS pension is one of the best pension for the in the world. So full of the benefits, full of everything, all your journey, and very rewarding. Right. Mm. Right, again, it's this is the NHS program. So Dr. Omar will be taking you through this one. This is all about that where how we put you at the heart of everything, how we make you our main focus, and how we make your journey very pleasant and very smooth. These are some of our other PLAB preparation package. We have got the PLAB 1 premium package. We have a PLAB 2. We have got Post-PLAB. We have got PLAB 1 and 2 combined. And just as I said, just focus on your studies and leave rest with us. We'll do everything for you. Uh, that's it from my side. Any questions? If you guys want to put into chat box, that would be good. I could answer at later. We'll have a question answer session. So we could do that one. So I will pass over to Dr. Umar now. As I said, Dr. Umar is our academic lead. He's a PLAB tutor. He brings a 20 years of experience. Wealth of experience. He's been a mentor. He's been a tutor in Manchester University. He's been teaching junior doctors, pharmacists, nurses, advanced nurse practitioners, and you will enjoy his teaching. So just over to you, Dr. Umar, now, and I will keep quiet now. I've been talking nonstop, so just over to you now. Thank you.
No worries. Thank you, Dr. Shakil. Good afternoon, everybody. Thank you very much for joining, giving us your precious time on a Saturday. If you just bear with me for a few seconds while I share my screen. Okay. Okay. Dr. Shakil, if you can confirm that you can see the screen, is that
Yes, yeah, yeah, it's
visible?
clear. Yeah,
Okay.
yeah, visible. Yeah.
No worries. Okay, right. So today, obviously, Dr. Shakil has already spoken to you about some of the anxieties for IMGs and for moving to the UK. What I'm going to do is I'm going to cover in a little bit more detail some information about both PLAB 1 and PLAB 2 today, which is new. And it will be useful for you. It will be interesting. So hopefully, if it does precipitate any questions, if you think of things, pop them in the chat box. We'll tackle them at the end. So I'm going to keep the first part very brief because I'm sure some of you guys will know about this stuff already, but there's two parts to the PLAB exam. There's PLAB 1, which is the written exam, tests your ability to apply knowledge. It's not just memorization or regurgitating facts, it's the application of knowledge, and it will cover the common, important, acute conditions, long-term conditions that are relevant for somebody for the level that this exam is set at, which is at the end of FY1 and at the beginning of FY2, or in language that is probably more understandable for IMGs, it is for somebody who has just completed their house officer year. Now, this does not mean that you need to be a house officer to sit this exam. This is just the level that the exam is set at. PLAB 2 is an OSCE exam. I'm sure you guys are familiar with OSCEs, Objective Structured Clinical Examinations, where you are given a scenario and then you're faced with either a patient or a model or a mannequin, and you have to go through the scenario, take a history, do an examination, perform a procedure, etc. Again, with both PLAB 1 and PLAB 2, all the questions will relate to current best practice. It's all related to UK-based guidelines, of course, and this is why it's very, very important for you to ensure that your preparation is up to date, it is good, it is current, it is by the people who have worked in the NHS and people who have examined in the NHS as well. So PLAB 1, a little bit more about the format of PLAB 1. Multiple choice question, actually single best answer is more accurate. 180 questions, 3 hours, so 1 minute per question. Quite time pressured. Starts with a short scenario or a description, followed by the question, and then you have to choose the most correct answer out of the 5 that are given. Now, PLAB 1 we're going to focus on first, just going to tell you a little bit about, because lots of people that we speak to, they want to know what the exam is made up of, what what kind of breakdown there is, and all these kind of things. So general medicine, as you'd expect, makes up a big part of the exam. Around 30 to 35% of the questions. This includes cardiology, respiratory, endocrinology, gastroenterology, etc. Then you have general surgery and surgical subspecialties, which again, you'd expect to make up a big part of the exam, 15 to 20%. And then after that, you move to the major specialties. So pediatrics, 10 to 12%, obstetrics and gynecology, 12 to 14%, psychiatry, 8 to 10%, emergency medicine, 10 to 12%. And then we're into the kind of non-clinical topics like ethics, professionalism, communication, consent, confidentiality, etc., 5 to 8%. Statistics and evidence-based medicine is 3 to 5%. And then finally, you have things like clinical pharmacology, which is around 5 to 8% as well. And then right at the very bottom, public health, preventative medicine. So these are things like vaccine schedules, screening, health promotion, 3 to 5%, ethical dilemmas and medical legal scenarios, including issues and things like negligence, autonomy, handling complaints, 3 to 5% again. So the reason why I wanted to go through this is to illustrate that, okay, regardless of the specialty you are doing or have done, or whether you're a fresh graduate, whether you have 25 years of experience as a cardiologist, you will need to know about general medicine, general surgery, pediatrics, obs and gynae, psychiatry, emergency medicine, etc., etc. And even the things that lots of people hate, like statistics, etc. So it's a broad curriculum. It's very, very detailed, and you really do need to spend time planning, preparing, ideally with with people who know the blueprint, know it inside out, and who can deliver it for you in resources that are useful for you. Okay, so a little bit about PLAB 1 study and exam strategy. So we'll focus on the study first. So as with anything that is any kind of task that is large, you cannot tackle it without a plan. So planning will obviously come first. Then comes the doing, which is studying, practicing. So that's so you're going through all of the areas of the UKMLA PLAB blueprint, which you will have to cover in depth because it's application of knowledge. See, the real test of whether you know something is not that you can repeat the fact or you can remember the fact that you memorize, but it's the fact is that you can apply that knowledge to a scenario, to a clinical scenario, to a question, or indeed, in fact, probably one of the best ways to demonstrate that you actually know something is you being able to teach it. So obviously the exam is not about you teaching it. The exam is about you showing that you can apply the knowledge. So we talk a lot about plans. We talk a lot about preparation at Hive. Plan, study, practice, analyze. So when you have put into action your plan, you're doing lots of studying, you're practicing the questions, you then need to understand that there are some areas that you're going to be weak at, either naturally or you haven't covered them well enough, and then you need to go back and adjust the plan. So this is an ongoing cycle, it's an ongoing feedback loop. And this is, of course, what we will kind of make part of your experience and coach you how to do this. A few other things that I wanted to mention: learning styles, knowledge, and exam techniques. So learning styles are really, really important. I'm not sure how many people think about them these days, but if you are a visual learner or if you are actually more suited to audio learning, you can make best use of your time by finding out which is the better learning style for you, and therefore maximizing the effect of your study and your practice. The fantastic thing about Hive is that all the learning styles are covered. All our resources are a mixture of visual, auditory, revision flashcards, notes, etc. So all of the learning styles are covered. When it comes to knowledge, of course, as you would expect, as it's a UK-based exam, it's an exam being set by the General Medical Council in the UK. It's all about UK practice, not about practice everywhere around the world. So you need the correct resources, you need up-to-date resources, guidelines are being modified and updated all of the time. Every month something happens, and if you are unable to keep up to date with that, then very, very quickly your knowledge will become out of date. The final thing I wanted to mention is about exam technique when it comes to PLAB 1. These are just some very, very basic tips, but if you are already doing some study or you're already doing some practice, if you just to get an illustration of how effective a small change can be, if you just use these 2 or 3 tips, and then you'll get an idea of the kind of preparation and the kind of guidance that you'll be getting at Hive to just see how much of a difference it makes. The first thing to think about is, what is the question actually asking me? What candidates do is they read the scenario quickly. What the brain does is it skips over words when you are skim reading, and so you formulate an understanding of the question, which a lot of the time can actually be incorrect. And you can miss keywords like not or less or something or more, something that is actually absolutely key to what the question means. And if you miss them, if you don't take note of them, you will have an incorrect understanding of the question, and therefore you're going to pick the incorrect answer. So keywords are important. Understanding what is the question actually asking me, ignoring irrelevant information. Sometimes there's lots of stuff in there that's put in there to fill some clinical detail, but also sometimes as distractors. And so you have to be good at picking these out, knowing what they are, and then ignoring them. And the final thing about PLAB 1 is time management is absolutely essential. You have 1 minute per question, 180 questions. And what that means is by the time you sit your PLAB exam, you need to be really, really good at managing your time and tackling these questions in a detailed but relatively quick manner. So, of course, at Hive, apart from all our learning resources, you actually get 10 timed mock exam questions. Now, what that means is you have access to 10 full mock exams, which cover all of the typical question distributions that you would expect in the real PLAB exam. It's timed, so your timer starts, you have 180 minutes, and you can actually put yourself into an examination scenario and see how you do. Of course, the tackling the mock exams should be at least towards the final 40 or 35% of your preparation time, because it's all the knowledge needs to be there first before you actually go to trying to properly, under time pressure, tackle the full format of the exam. So that's PLAB 1. We've mentioned these kind of things a few times before, but it's useful to be able to go over them. If you do have any specific questions, just drop them in the chat box or raise your hand at the end and we'll tackle them. So let's move on to PLAB 2 now. So PLAB 2, as you guys know, is a OSCE scenario, a OSCE type exam. There's 18 stations, but 2 are actually rest stations. So it's actually 16 scenarios. You have it's 3 hours and 10 minutes, so another long examination. You have 90 seconds, so 1 minute 30, to read the scenario or the information or the instructions outside of the station. And then you go inside and you have 8 minutes in every station. So 2 rest stations, 16 scenarios. So again, another very intense examination. So I wanted to cover a little bit about what actually gets tested, or what the GMC are actually looking for in PLAB 2. So there are 3 main domains which are used in the marking schemes, and related to the domains are the skills that are being assessed at the same time. So the 3 domains are data gathering, technical and assessment skills, which are grouped together. Then there is clinical management skills, and then there are interpersonal skills. So we talk a little bit more about the kind of distribution of the assessment in the PLAB 2 exam and what is more important, what is not as important. But data gathering, technical and assessment skills, what does this actually cover? This covers, if you see on the right side of the screen, history taking, physical examination, practical procedures, and investigations. So these are all the parts of the consultation that are relevant to data gathering and technical skills. Then you have the clinical management skills domain, and here is all about formulating the diagnosis, explaining something to the patient, or formulating a management plan. So you have data gathering, which of course, conventionally in all kinds of consultations, as you'll know, whether you're a medical student or whether you've been a consultant for 30 years, you do the data gathering first. And the data gathering consists of taking a history, doing a physical examination, maybe doing, maybe performing a procedure, something like taking a blood pressure, etc., thinking about investigations. And then the clinical management part always comes second, and that's where you have to explain your reasoning, you have to explain what you think is going on, and then negotiate with the patient a management plan. The final domain, which is of course, all 3 are important, but interpersonal skills are extremely important, especially for IMGs who might not be used to the nuances of language, as of course English, is for the majority of them is not going to be their first language. So it's important to understand how crucial communication is, how crucial language is, how you speak, how you interact with the patient, things like professionalism, etc. So interpersonal skills covers, the GMC says, how you approach the station. how you establish a rapport with the patient. Do you actually connect with the patient? What kind of questions you use, open and closed questions? Do you involve the patient in your discussions? Do you demonstrate professionalism in the way you speak and in the way you conduct yourself? And do you have an understanding of ethical principles? So that's an idea of the domains that are being looked at in PLAB 2. And linked to the domains are the skills. So what the GMC says is the domains are these three, and then the skills that are actually being tested as part of these three domains are clinical examination, practical skills, and then of course the interpersonal skills. So what actually happens in PLAB 2 stations? Now, this slide is just demonstrating to you the kind of things that you might come across, what you might face, what might be in there, etc. So simulated patients or actors, I'm sure you're very used to this. You will have hopefully come across this in medical school or in other postgraduate examinations. You have people who are not actual patients, but they are actors acting as patients. There may be models, so there may be a model of a head and neck or a model of an arm, for example. There may be mannequins, so actual, full body size mannequins, which you might need to do CPR on, or high fidelity mannequins. These are things like SIMMAN, which is spoken about a lot, which allows the assessment of emergency scenarios, for example. Then there's common practical procedures. So these are things like blood pressure, phlebotomy, cannulation, inserting a catheter, performing a intramuscular injection, or any of the kind of things that you would expect, or maybe even, examinations are included. So rectal examination or bimanual pelvic examination, which of course you're not going to do on a real person, they'll be done on models. So these are common practical procedures that are expected for the level of people who are at the end of the house officer year or FY1 year and going into the FY2 year or the senior house officer year. And the final point here is that, of course, there's interaction between you and another person. So there's you and the patient, you and the model, you and the mannequin, you and the examiner, even in some of the stations at the end. The interaction might be in writing only, so it might be a prescription station. There's nobody else in there. There's no examiner in there. You're supposed to write a prescription, or you might be interacting with somebody via a telephone, which is set up in that station. So what is the main focus of the PLAB 2 exam? So this slide illustrates just how important communication skills and interpersonal skills are to the PLAB 2 examination. Now, obviously, you cannot do a history or an examination of a cardiovascular system, for example. Focused history, focused examination, and then come up with a diagnosis or a management plan without without demonstrating some clinical knowledge or some knowledge of pathophysiology. Of course, that will always be there, but that makes up 30 to 40% of the station. The majority of the marks in the station will be for your communication and your interpersonal skills, 50 to 60%. Then application of the knowledge, whether that's in arriving at a likely diagnosis, or whether that's explaining something about a procedure to the patient or discussing treatment options, that makes up 10 to 20%. So the purpose here is to highlight how important it is for you to be able to communicate and to interact with people in a professional way that is acceptable and that is of a standard which is expected by the GMC for working in the NHS. Now, this can obviously be very different, can be at the opposite end of the spectrum to what you're used to having practiced or studied medicine in a different country. So what do you actually need to do in the PLAB 2 exams? Now, I examined OSCEs for many, many years, and I understand very, very well what OSCE examining is all about. OSCE examining is is about showing that you know, and it's about showing that you care. So the aim is to appear slick. You want to look like you have done this examination, this history, this procedure, this explanation 1,000 times before. You want to make it look like you are confident, you're knowledgeable, and you're decisive, but also at the same time you're empathetic. So you're able to have a a connected conversation with the person who's the patient, and you have to do all of this without appearing arrogant. Now, this is a difficult skill. It takes lots of practice. It takes lots of coaching. Even for myself, who, of course, I went through undergraduate medical studies in the UK, postgraduate exams in the UK. This takes years and years of practice to actually get really good at this. When you're doing it for PLAB 2, you don't have years and years. You might have several months. You might have 6 months. You might have 12 months. You might only have 3 months. But the point is that it has to be something, because this is new to the majority of international medical graduates, this way of interacting with patients, this way of communicating with patients, this way of the consultation being all about the patient and not about the doctor, not about the knowledge, not about the 100 causes of clubbing. This is not what PLAB 2 is about. PLAB 2 is about being patient-centered, and it's about being safe. Now, what does patient-centered mean? Patient-centered means that the patient is at the core of everything that is done in the consultation. So when you are listening, you're listening because you actually want to hear what the patient is saying. You want to use that information. You're not thinking in your own mind, what's my next question? You're actually listening actively, because the patient will be giving clues, they'll be giving hints, they'll be giving kind of waving little flags that you need to notice and you need to acknowledge and you need to feedback, and then you need to pick up and start a discussion on. So that's what patient-centered means, being in the data gathering part. In the management part as well, being patient-centered means that the patient is at the center again of the management options, the treatment options, the issues that came out of the consultation. It all has to be about the patient, what's important to the patient. Of course, there'll be a medical element to it. Of course, there'll be red flags. Of course, there'll be things that you have to explain, that you have to ask, certain questions that you have to ask. But it's a very, very difficult skill. You need lots of coaching and you need lots of practice. Now, what does it mean to be safe? Being safe means that you know the limits of your competence. You know, and I'm not ashamed to say, actually, I don't know about that, because this is not something that is looked down upon in UK medical practice. This is something that is actually encouraged, because if you have practitioners, doctors, nurses, whoever they are, who understand the limits of their competence, then they will never do anything that is unsafe. And safety is an absolutely key feature of PLAB 2. So it is much better for you to acknowledge the limits of your competence. So this is in the real world as well. Real patients and patients in the UK are actually appreciative of this. This might be the total opposite to what you're used to. Maybe in a different country, if you say, actually, I'm not sure about that, I need to check, or I need to discuss with my senior, or I just need to double check that and then get back to you. People might think, this guy doesn't know anything. He's not a competent doctor. In the UK, it's the total opposite mindset. So you must be patient-centered. You must be safe. You also must do something. Being safe also means that you take the correct clinical decisions at the correct time. For example, you have somebody in front of you who, let's say, they have sudden thunderclap headache, and everything, there's some red flags there suggesting maybe that there's an intracranial hemorrhage. The safe thing in that scenario is knowing that this patient needs to be admitted. So being safe means lots of different things. And of course, when you come into our academy, when you enroll on our programs, these are all of the kind of things that we are going to explain to you. We're going to coach you. We're going to watch you practice many, many, many times. You'll get live feedback. And then, of course, that's how you improve. So very quickly, just going to mention finally about exam strategies for PLAB 2. Now, the first point, as you would expect here, practice, practice, practice. There is nothing better than doing. Sorry, I'll reword that. There is not much better than just doing, except for doing it when it's guided, when it's properly observed, when you're getting proper feedback, and when you are being taught, and when you are being supervised, and when you are being assessed by people who know the exams, who know the healthcare system, who know the nuances of the language, who know the ways to kind of help students improve their communication, who know the techniques, who can give them the hints, and who have examined these kind of exams many, many, many times before. So practice, guided practice is the best thing that you can do. So the 90 seconds, just a few other things, the 90 seconds before you go into the scenario, it's a little bit like that PLAB 1 question where you read that scenario properly, you use the 90 seconds well, you actually use that time to formulate a strategy in your mind. Now, this is obviously something that you should be, all the knowledge should be there by this time. By the time you get to the exam, you should be confident with the NICE guidelines for hypertension, the NICE guidelines for diabetes. You should be confident in being able to handle a breaking bad news scenario or an angry patient or whatever else. But you use that 90 seconds to make some mental notes, formulate that strategy so that the consultation goes well. Having a structure or a framework to your consultations will be helpful for a number of reasons, but not a script. So having scripts just comes across, and again, I'll come back to the fact that I've examined OSCEs for many, many years. You can tell the students who are in front of you who have done this many times before and who are doing it naturally, and you can tell the ones who have just memorized something and who are just who are missing clues. They're missing clues in what the patient is explaining to them, and they're regurgitating something that they have just memorized, which is like a script. Scripts are bad. Structures and frameworks, whether it's Socrates, whether it's certain mnemonics and prompts, these are really good because, of course, what can happen in a consultation happens in clinical practice, happens in exams. You can go blank. You will go blank. This happens. But when you have a structure, you can take a second or a few seconds to reset yourself and get going again. So some of the things that I use, so ICE, of course, ideas, concerns, expectations, listen, explore, explain. Spikes is for breaking bad news. CAMP is for counseling, for explaining things. Smart ICE-T is something that we've developed ourselves, and we'll go into that in more detail in our courses. The final thing about PLAB 2 exam day strategies are the 2 golden minutes. There are 2 golden parts of the consultation. One is when you are listening right at the very beginning. So when you do your introduction, you ask an open question, and then you just sit there, you be quiet, and hopefully the patient will share lots of information for you, and you will already get lots of that information. If you interrupt the patient, if you start asking closed questions, you're going to miss the prompts, you're going to miss the clues, and you might miss the whole focus of the station. The second golden minute is in the second part of the consultation when you are doing the management part. So you've done the data gathering, you're in the last 2 to 3 minutes, you're doing an explanation, you're discussing a diagnosis, or you're discussing a management plan or treatment options. But also you are going to bring back from that first part of the consultation some issues that came up that were important to the patient. And that minute is important as well. You take a minute, or the best part of a minute, to set up that discussion, to explain to the patient, to summarize what's happened, to highlight the things. And of course, you've got somebody sat there who's listening, who's taking note, who's marking the examiner. So lots of this is, of course, for the it's because you're in an examination, you need to let the examiner know that you know how to listen and you know how to pick up prompts, and then you know how to highlight important issues. So it's a complex process. It is a high level skill, and it takes lots of practice, lots of coaching, and you can only do that effectively with some mentors, with a group, with with the exam scenario type of practice, which of course is what you will get at Hive. Just finally as well, because I forgot to mention this at the beginning, lots of people might not know that your actual stations, won't take a full cardiovascular history followed by a full cardiovascular examination. Obviously, you only have 8 minutes. So there's usually a focus for the station. So the focus might be more on history taking, or it might be more on doing a targeted examination, or it could be a combination of the two. But of course, then you will be more focused. You will be, less detailed about the broader things. You'll need to narrow down on the things that are important. And it's the same with the examination. Or of course, it might be just doing a procedure, as we've said, or writing a prescription, or counseling a patient about options for treatment, or telling them about having an angiography or something. So there will be a focus to the actual examination. The GMC don't expect you to be able to do a full thorough medical school style history followed by a full medical school style cardiovascular examination, and then weigh things up and make a diagnosis and explain all the treatment options in 8 minutes. Obviously, that's impossible. So it's all about, again, coming back to knowing what the scenario wants from you. And these are the kind of things and the kind of tips and the kind of processes that will take you through. Just briefly, they are difficult exams. They're difficult not because the actual, because you guys don't have a lot of knowledge, or you haven't been to medical school, or you haven't got lots of clinical experience. That's not why they're difficult. They're difficult because it's for a new country, new guidelines, new types of drugs, new way of doing things, new way of speaking to patients, new way of communicating, new focus for what you are actually doing when practicing medicine. These stats from the last 5 years show that a large percentage of people do unfortunately fail their PLAB exams. So you can see the percentages range from 30-something%, between 30-odd% and 20-odd% of people actually don't make it through. So finally, I'm going to move to what Hive is all about. What are our solutions for the problem, which is the PLAB exams? So number one, we can present something that's comprehensive, which is already prepared, or we can actually customize something depending on what you need, what your preferences are. And this is what Dr. Shakil was saying about we place the student, the candidate, right at the center of the focus of everything at the academy. So yes, we do have pre-prepared courses and pre-prepared resources, but we can also be flexible. Whether you have only 1 month to prepare, or you have a full year or longer, we will do it together. We have done it, and we will continue to do so. Our resources are fantastic. They do cover all the bases. They cover all the learning styles and teaching styles as well that you would need. And to actually have a look at this, if you visit our YouTube channel, I'm not going to share the screen and show you today because I don't want to take too much more of your time because we're already around the hour mark. Check out our learning management system. If you go on our YouTube channel, you'll see it was posted fairly recently, and you should be able to see which is the video demonstrating our learning management system, where I show some examples of what it looks like. The final thing on what our solutions focus on is support from the first thoughts of your dream or your vision to move to the NHS, and then even beyond your exams, beyond completing the PLAB exams, beyond getting your NHS job, we will always be there for you, available for you to offer support and advice. What makes us different there's lots and lots of people out there, lots of companies, lots of academies doing lots of good work. We would never denigrate somebody else or criticize somebody else, but we wanted to highlight why we are different. So it's personal. It's all about what you need. Whatever you need, we will deliver it for you. Myself and Dr. Shakil, it's our stories that drive everything about the academy. Dr. Shakil was an international medical graduate. He's been through the process. I'm somebody who was on the other side of the pond, so to speak. I was born and grew up in the UK, was educated in this system, including medical school, postgraduate training, and then actually became an examiner and started doing all of the things and sitting in the positions where the people who are actually assessing the ones who want to be the doctors and want to come to the NHS. So we've got both sides of the journey covered. We're always there for you. You will not find an academy who is as accessible as us. We never stand still. We're constantly improving and updating our courses. We're doing it all the time. I'm currently doing it right now. Even it's always something going on to try to make things better. We fill in the gaps. There's lots of gaps in the provision for IMGs out there. Mainly post-PLAB support is one of the biggest ones. Customization of courses and delivery to the actual learner's needs. That's another one. We do all these things, and of course, all of the Hive team know that we are all about setting our standards. The standards are very high from whoever comes into the team, for whoever comes into the academy. We set high standards, and we expect to maintain them, and we do that from door to door, from entry to exit. Finally, I keep saying finally, I know, but this is only going to take a few minutes to tell you about this. The Global Medics NHS program, GMNP, is a new program which is literally just being launched as we speak. What this is essentially your personalized pathway to the NHS. So remember at the beginning of the webinar, Dr. Shakil, mentioned what the journey is like, what the anxieties are like, what are the steps. This program will incorporate everything that you need to do to get from your home country to that first NHS job and continue to support you after that. So if you are thinking about an NHS career, or you're dreaming about an NHS career, or you just want to, you want to move to the UK because it's a fantastic place to live. Of course, I'm going to be biased. I've lived here all my life. Dr. Shakil's lived here for well over 20 years. But it is a brilliant place to live. It's a brilliant place to work. And that's why lots of people from around the world, tens of thousands of professionals come and join every year. So this is what this program is all about. Why would you consider this program with Hive? So we've mentioned lots of things already. I don't want to be repetitive, but it's all tailored to yourself. There's fantastic flexibility. You get comprehensive support. You get hands-on experience. You get to choose how you want to do some of your preparation. You can do it online. You can do it live. You can do it face to face. And there is end-to-end career support, which means from that very first thought all the way to even once you've smashed the PLAB exams, which you will do if you join this program, even once you've gone beyond that, you've become, you've joined a specialty program or you're doing something else, we will always be there for you to share our experience and to share our knowledge with you and to give you good advice. The final thing is that this is officially going to launch from next week, but we're already taking registrations for it. We've already got people who have registered. If you are a final year medical student, or you are a medical graduate or a practicing doctor at any stage of your career, you are eligible. As we said, there's totally flexible options for you to complete the program. You can do it online. You can do it. You can do it face to face. There will be live sessions. There will be there's on-the-go learning, but there will be, of course, because PLAB 2 needs to be done in the UK. There will be a part of the program, of course, where you have to actually be physically present in the UK, but that's not a bad thing. Fantastic place to visit. It's a one-year program, and it covers all the stages that you need to move from your home country to get your first NHS job, and then, as I've mentioned, to continue to support you after that. So do do reach out, do ask questions. If you've got some questions now, I'm sure the team are happy to stick around and answer them. But visit the website, check out the pages, use the QR code, check out our social media channels, and to get an idea of what this is about and how we can help. I think I'm going to stop there. Probably spoken for slightly too long, but there was a lot to cover. So thank you very much for listening. I'm going to hand back to Dr. Shakil now, and let's see if there's anything else that needs to be covered. Thank you.
Thank you so much, Dr. Umar. That was very comprehensive, a very good session, especially for the IMGs. And I'm sure they are well aware now after this session. They would know that what's the exam structure, what's the percentage of questions, and what they should prepare and what they should look forward, and how we could help them. So kindly, please, if you have got any questions, just feel free to ask now. We have got Dr. Wide, we have got Fatma, we have got Hasnat, we have got Asma. So please feel free to ask any questions. No questions, so it's okay. So once again, thank you so much for Asma, our executive member from Islamabad. Thank you so much, Fatma, and you're always there, either it's day or night or weekends. So really appreciate all your support. And thank you, Dr. Umar, and thank you for Hasnat, Dr. Waid, and others for attending this webinar. You have our contact numbers, so you can contact from our any social media pages, or you can contact us from our website as well. We are always here for you. So all the best for your exams, and see you soon. So I think we'll say goodbye to everyone. Thank you so much. Thank you.
Thank you. Thank you. Have a good weekend, everyone.